In our third module, you'll learn about neuroscience-informed assessment. And here I'm not talking necessarily about brain scans. I'm talking about how you would integrate assessment from a neuroscience perspective into your work with clients. So one example of this would be a non-technology-based form of assessment known as the assessment of lifestyle behaviors and the integration of therapeutic lifestyle changes into counseling practice. In my experience, this is far underutilized in the counseling profession. We don't tend to ask about lifestyle behaviors as much during intake assessment. And I think it's very important to do this in terms of how a client is performing overall in their life. So we'll learn about this during the part of the module focused on wellness and optimal performance. We'll also learn about more technology-based forms of assessment. Here I'm talking about biofeedback and neurofeedback in the part of this module focused on clinical-based assessment using neuroscience. And then we'll also explore, as part of that same piece of the module, about different psychological tests that can be used to assess a person's cognitive performance and attention, memory, things like that. I'll add that the third part of the module is focused on the neuroscience of mental disorders, and here we're going to focus less on anxiety and depression, the more, I would say, common mental disorders in mental health settings. Those were touched upon in the first module where we learned about psychopharmacology. Here we're going to be learning about more complex brain-based disorders, for example, traumatic brain injury. We'll learn about stroke. We'll also learn about neurocognitive disorders, such as different forms of what used to be called dementia, Alzheimer's disease being one. And we'll look at some of the complex neurodevelopmental issues that can emerge in childhood, such as ADHD and autism. So in this module, you'll definitely have, again, some complex terminology to grapple with, but I think less so than in some of the other modules as we start moving towards the application of neuroscience into counseling practice. I'll mention also as the conclusion of this introduction to the module that remember the technology-based assessments that you'll be learning, biofeedback and neurofeedback, require substantial training that you'll have to pursue post-graduation if you wanted to be a neurofeedback or be a biofeedback practitioner.